Okay, I'm going to have you grab your second to lightest loop band, and you're going to bring it around your wrists, and you're going to come to lie on your back, supine. So you're lying all the way down on your back, and the arms are going to go overhead, all the way overhead with the wrist in the band. And we're going to move into what I call banana pose. You're going to take your legs to one corner of the mat, sliding them over like a banana, and you'll bring your upper body in the same direction, pulling out on that band, palms facing in towards each other, plugging the shoulders down. Go ahead and cross the leg that's closer to the center of the mat over the outside leg. Cross the ankles and try to guide that hip down towards the floor, getting into the hip flexor. If this is too intense, you can take the cross out of the equation and just keep the legs together. Focus on your breath here. See if you can arch your low back a little, extending your tailbone towards your feet. And then add a little movement of your torso by lifting your upper body back up to center and then bending it again. So you're sliding the body along the floor, just the upper body. You exhale, bend the upper body, creating a deeper C shape or banana shape, and then you bring your torso back upright and center. Exhale to bend, sliding the body along the floor. Inhale, bring it back to center. So the legs are held isometrically and the upper body is moving and active. This will help you recruit the external obliques. Make sure you're breathing. Hear your breath. Go ahead and switch sides, setting up for your banana pose on the other side. Cross the ankles if possible, trying to guide that hip down to the floor, opening up your hip flexors. Use your wrist to pull out on the band, palms facing in, plug the shoulders down. Think about your low back arching a little, creating some space between the low back and the floor. Try to imprint your shoulder blades into the floor, centering the head. And check in with your breathing. Inhale through the nose or mouth and exhale out the mouth, creating an ujjayi sound, the ocean breath. Again, inhale, 2, 3, 4, ujjayi breath. Option to move the body, sliding it up and sliding it back into the bend, or stay where you are, just allowing the body to release into the posture. We'll be here for another 15 seconds using that ujjayi breath. On your next inhale, you'll slowly bring the legs and body back to center and set that band to the side. Grab your small anti-burst ball and you're going to place it between your knees. Now, if you have a tight low back, you may want a bolster handy. We're going to be doing some twisting for the abdominals. We're not going to be holding the twist down, but maybe that can be a marker if you put it to one of your sides as to how far the knees windshield wiper to the side. So we're still lying supine on our backs. We've got the ball between the inner thighs up near the groin area. And our hands are in a T position out to the side, palms facing up. Take a moment to plug your shoulders down, reach your tailbone towards the bottom of the mat, and inhale the legs up to tabletop. Flex your feet. Take one hand under your low back. Is your low back flat against the floor? Can you tip the tailbone towards the bottom of the mat and create some extension? We want to try to maintain that and get to that position every time the legs come up. So you're going to exhale and use your inner thighs and low abs to tick-tock the knees to your right. And then you're going to hold it here. Inhale 1, breathe. Exhale, pulse in on the ball. 2, 3, 4, and inhale, bring the legs back up to center, and that's all it is. We'll alternate sides. Exhale, taking the knees to the other side, holding it down, reinforce that extension in your pelvis, squeeze in on the ball, and then inhale, lift back up to center. Great. Watch out for the climbing shoulders. Keep them pressing down the spine. Soften the sternum in towards the back body. Pull the low belly in and make sure the knees track over the hips when they come up, that they're not getting farther closer to your chest. That's going to increase the load on the lower abdominals. Tip your tailbone towards the bottom of the mat. Hear that breath, inhaling to lift and exhaling to lower. We have one full breath at the bottom where you breathe in and you squeeze in on that ball with those nice little pulses. Feet are dorsiflexed like a dorsal fin. Engage those feet. Give me one more set on both sides using that breath. You're doing great. Hang in there. And once you've completed those, you can roll off to one side, hold on to that ball, and come up to a seated position. Now, this is going to be an extra challenge for your core. And what I want you to remember more than anything, that your back, your low back position is the most important component of this exercise. So I want you to think about your arching in that low back. So when you're in a seated posture, because of the tightness in your hamstrings, we tend to round the low back. So I want you to sit up tall on your mat, place the ball back between the inner thighs, knees are pointing up to the ceiling, heels are down, toes are flexed. And from here, we're going to stretch our arms out in front of us like Frankenstein, palms facing forward. We're going to hinge back a few inches, tipping the tailbone back, hinge the upper back back, and extend one shin out in front of you, flexing the foot. Squeeze the ball, hold it here. Inhale one, breathe, and exhale one. Palms facing in towards one another. Inhale two, and exhale, lower that shin down. Switching sides. Come on up to a tall seated position. Inhale. Exhale, hinge back. Tip the tailbone back, extend the other shin, hold it up. Inhale one, breathe. Exhale one. Good. Inhale two. Exhale two. Lower the shin. Inhale back up to your tall seated position. One more time on each side. Tip the tailbone back. Exhale, hinge back. Inner thighs pull you back. Extend the shin. Inhale. Pelvis reaches towards the front of the mat. Abs in. And good. Bend the knee. Put the foot back down. Inhale, lift up. Pelvis pulls down as you come up. Last time, take it back. Hinging back. Lower abs in. Extend the shin. Flex the foot. Inhale one. Breathe. Exhale one. Inhale two. Exhale two. And inhale. Lift up as the pelvis pulls down. Great. From here, let's make our way onto all fours, our hands and our knees. You're going to need your second to heaviest loop band around your upper arms, above your elbows. In the YouniquelyFit set, this is our purple band. And it goes above the elbows. This is going to help us engage our scapular stabilizers. So both arms right above the elbows, and not too high because then it's going to be in the way of your head. So right above the elbows. Make your way onto all fours, hands and knees. Pull out on that band, feeling your scapular stabilizers. From here, arch your back, sending your chin and chest up and your tailbone back. Pull the abs in. Hold it there. Inhale one, breathe. Exhale one. Inhale two, stay here. Exhale two, look up, brace your abs. Inhale three. Exhale three. Inhale four. Exhale four, abs are tight. Inhale five. Exhale five, stepping back into a plank. Keep that band on. Step yourself back into a plank. If you have back issues, keep your feet hip distance apart. If you don't, you can have your legs together. Pull the low abs in. Pull out on that band. Press down and out press down into the hands and pull out on the band. From here, inhale, prepare. Exhale, tap the knees to the floor. Both knees at the same time. Inhale, lift them up. Exhale, tap them down. Inhale, reach the pelvis to the feet as you lift them up. Great. Exhale, tap down. Inhale, lift up. And exhale, tap down. Inhale, lift up. And one more time. Exhale, tap down. And inhale, lift up. From here, lower onto your knees. Rise up onto your knees. Bring your hands to your hips. Glide that band down to your wrist. So it's going to stay on your wrist, palms facing in. Take the arms overhead. Tuck your toes under. Tuck your toes under. Good. From here, inhale. Pull your pelvis down towards the floor, pulling those low abs in. And exhale, side bending to your right. Bend over. Hold it here. Inhale one. Breathe. Exhale one. Pull out on that band. Turn your head down on the diagonal or up on the diagonal, whatever feels best on your neck. Inhale two. Exhale 2 and inhale back up to center, pulling your pelvis towards the floor. If the knees hurt, roll the mat up a couple of times and rest your knees on that. Bending to the other side, take it over. Exhale, pulling out on the band, hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale back up to center. Pull the pelvis down as you come up. One more time to the right. Take it over. Hold it here. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale back up to center. And last time on the second side. Pull those low abs in. Bending. Hold it here. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. And inhale, bring it back up to center. Set that band to the side. Great job. We're going to move into some back work. I'd like you to lie on your stomach, and you're going to bring your hands right by your chest. So we call this prone position when you're lying on your stomach, hands by the chest. We're going to work on our cobras. If you have back issues, keep your legs hip distance apart. If you do not, you can have them right smack dab together. Either way, they're parallel, tops of the feet resting on the floor. From here, hug your triceps in by the side of the body with the hands right under the chest. We're going to lift up to Cobra Pose. So this is halfway between up dog and lying prone. So lift halfway up, hands by the chest, triceps hugging in by the side body. Hands by your chest on the floor. And then lift halfway up, Cobra Pose, hold it here. Inhale 1, breathe. Exhale 1. Inhale 2, and exhale, lower your chest back to the floor. If you're feeling pain in your back, I want you to inhale, pull your pelvis towards your feet as you come up, and then exhale, give me that ujjayi breath with the belly in. Hold it up at the top. Inhale, lift up, pelvis pulls down. Exhale, ujjayi breath. Stay here, inhale, pelvis pulls down, abs in, and exhale, lowering down. One more set on the breath. Bring it up. Inhale. Brace those low abs. Exhale. Inhale. And exhale. Lower yourself down slowly. Great. Come back up onto your hands and knees. Grab that second to heaviest band. It's the purple band in the YouniquelyFit set. Bring it back above your elbows. And now you're going to come into a forearm plank. So your forearms are down. You're going to step back into a plank. Again, option to put the knees down if a plank is too much for you today. So on the forearms, down on the forearms, and feet hip distance apart. Together, if you don't have back issues, hip distance apart if you do. Hold it here. Inhale. On your exhale, I'd like you to lift your right leg, keeping the toes flexed, just an inch. Lift it up. And lower it back down. Inhale, lengthen the pelvis to the feet. And exhale, lift the opposite leg up just an inch. Toes stay flexed. And lower it down. You can tap the knees down when you need a little break. Inhale, prepare. Exhale, lift. And lower. Inhale, prepare. Exhale, lift. And lower. One more time on each side. Inhale, prepare. Exhale, lift. And lower. Keep those low abs in. Tip your tailbone up. Take the knees to the mat. Great. From here, let's take that band off, and we're going to come to lie on our side. Lying on our side, you can prop your head on the ball or a block, or you can take the bottom arm to your head and support it. You're going to take your top hand to your hip. Bring the thumb to the bony protrusion of your hip, and the fingers will point down towards your feet. Pull your shoulder blades together and plug your shoulders down your back. Now, if this hurts the hip, your bottom leg's hip, bend your knees a little more into a fetal position and tip your tailbone back to whatever's behind you, arching your low back. Lift your top leg up. I want you to do a reverse bicycle motion with that top leg with the foot flexed. So you'll kick back and sweep forward. So instead of bringing it forward first, you're going to kick the leg straight back behind you and then sweep it forward. And I want you to really use your abs and focus on how still you can keep your torso. This is all about isolating, using your butt muscles, using the quadriceps and hip flexors, working the foot by dorsiflexing it. You're getting into the internal obliques to stabilize your pelvis here. Keep breathing through that. Give me 4 more on the breath. I like to exhale back, inhale forward, taking my time, going very slowly. Shoulders plugged down. After you've done 4 more reps, we're going to flip back into plank. This time, regular plank, push-up position. Bring that band above your elbows. Second set of our leg pullback. So that was lifting one leg, flexing the foot. What happens here often is you tend to send the butt up when you take the leg up. I don't want to see that. I want you to keep the pelvic extension we found when we were lying supine. So tip your tailbone up, pull your abs in, find plank, legs hip distance apart. So regular plank this time, up on your hands, walk up to the hands. Hold it here, inhale. And exhale, lift one foot up, flexing the toes. And lower it down, alternating sides. And lift, inhale, exhale, lower. Really try to bring the pelvis down, pull the low abs in and up, tip the tailbone, find some lumbar extension. We're going for 6 repetitions, quality versus quantity. Pull out on that band, push down into the hands, lift your chin, don't strain the back of your neck. And hold. Once you've done those 6, you can lower the knees down, take the band off, and make your way to that side lying position for your reverse bicycle on the other side. Setting up, supporting the head. Watch out for rounding in the low back here, so you can always bend the knees and move more into a fetal position. Top hand to the hip, thumb on the bony protrusion of the hip, fingers pointing down towards that leg. Pull your shoulders down. Imagine my hands on your shoulder blades. Try to bring your front ribs towards my hands. Closing off that rib cage, pulling in the core. Dorsiflex your foot like a dorsal fin. Use your breath. That Ujjayi breath is there to help you contract your transverse abdominis. So as long as you're not pushing your belly out and you're pulling it in, as you constrict the vocal cords on that exhale, you will contract the deepest layer of your core. And that's what alleviates back pain. So it's imperative that you condition the TVA. And I'll keep reminding you of that as we're working today. Give me 2 more. 2. And last one. And 1. Great. From here, I'd like you to grab a 3-pound weight. And we're going to make our way onto all 4s. So we're going to be conditioning the triceps, the back of the arms, as well as the posterior delts here. You'll notice we'll also get into the lower abdominals. So all 4s position, wrist under shoulders, knees under hips. Hold the weight in your non-dominant hand first and pull that hand towards your hip. It should be a few inches from the hip, straight arm. Take it to the hip, straight arm. Good. Extend the opposite leg behind you, straight out, flex the toes. From here, inhale, prepare, pulling the pelvis towards the wall behind you. Exhale, circle the shoulder of the arm that's lifted back 4 times. Circle it back, not forward, back. 4. Try to keep the arm lifted by the hip. Soft bend in the elbow. 2. Takes a lot of muscle strength in the upper back to do this correctly. Inhale, prepare. Exhale, circle it back. 2. 3. Try to keep the chin lifted as you do that. Inhale, circle it back. Don't let the elbow droop. Give me 1 more. Hold it up. Use your breath. Circle back. Soft bend in the supporting elbow. 2, 3, 4. Switch sides. You're doing great. If your back is bothering you, you got to use the Ujjayi breath. Pull the belly in on your exhales. Tip your tailbone up. Remember cow position. Show me cow position real fast. Arch, chin up, chest lifted, tailbone back. That's the position you need to be in for your all 4s, okay? So try to find that and hold that when that leg goes out. You want to maintain that pelvic position. So let's move to the other side, taking the arm back by the hip and the leg, opposite leg extended, foot dorsiflexed. Inhale, Ujjayi breath, circle the shoulder back. 2, 3, 4. Inhale, prepare, exhale, circle it back. Brace those abs. 2, 3, 4, and 1 more time. Inhale, brace, exhale, circle it back. You've got this. 2, tip the tailbone up. 3, low abs tight. 4, and set that weight down. Come back into cow pose, chest and chin lifting up, tailbone reaching for the sky. Inhale 1, breathe, Ujjayi breath. Bracing those abdominals. Inhale and exhale. One more. Great job. We're going to move into some lower body work. I'd like you to grab the ball to place under your head if your hamstrings are tight. And you're going to grab your second to heaviest Theraband. And this with the YouniquelyFit set is our blue Theraband, long Theraband, and our small anti-burst ball for the head. You can also use a pillow or a yoga block if the ball's too high and causes discomfort. If you happen to have open hamstrings but you still have flat back, then you don't need the ball. You can rest your head on the floor. Start with your dominant leg. Your dominant leg is the same side as your non-dominant arm. So we work in opposition. So right-handed, right leg, left-handed, left leg. And we're going to breathe here. Oh, I said that wrong. I'm sorry. So dominant leg is the opposite leg of your dominant arm. So if you're left-handed, which I'm left-handed, that's my right leg. If you're right-handed, that's your left leg. Let's all move into that stretch. The reason we start with the dominant leg, both in flexibility and strength, is we want to spend a little longer on the dominant side flexibility-wise, and strength-wise, we actually want to do less repetitions on that side, but we always want to start on it because our muscle memory will translate to the other side, so we can improve muscle imbalances and we can help that weaker side catch up. So the foot is dorsiflexed. Watch out for the back here. Tip your tailbone towards the bottom of the mat. You can take one hand under and check your low back out. How's it doing? Are you maintaining a little bit of space between the low back? If you're not, that means you need to lower the leg just a little bit. It may be a little too high. And if you don't have enough band, like if your leg is that far away, you can always put a loop band around the foot and then take the band through it to create a longer lever for you to control. Be where you are right now, hearing that breath, opening up the posturally tight hamstrings. After 2 more inhales and exhales, bend that knee, slowly bringing that leg to the ground, and let's switch sides. If you're experiencing back discomfort here, you've got to pull the abs in towards the spine, and you must use that Darth Vader-like fog and mirror sound. On your exhale, we've got to work that TVA. And you need to be conscious of where your pelvis is in space. The chronic pelvic flexion is what's causing the low back issues, the overactivity of the hamstrings and calves. So once we can learn to work in neutral pelvis, we can recruit the quads and hip flexors so we balance out that leg chain. So we've switched legs by now. Go ahead and switch if you haven't, and let's catch up on this side. I often will hold the band with the opposite hand as the leg that's up and take the other hand to the hip to make sure I'm not hiking the hip of the leg that's lifted. And that sometimes helps you check your form out. Keep your foot flexed. Hear your breath. So with flat back posture, we have a lot of flexibility issues that hinder, more than anything, they have you run the risk of injury, because you do have a lot of strength ability. So we've got to balance that out. And that means more time doing active and static stretching than actual strength work. Go ahead and take that leg down, set the band to the side, and I'd like you to grab your second to heaviest loop band to assist with our Piriformis Stretch. Again, you can have that ball behind your head if your outer hips are tight. And that's the purple band in our set. We're going to lie all the way back, and it's going to go around the thigh of your non-dominant leg. So the same leg as your dominant arm. It goes around that thigh, and you're going to hold it, and then you're going to cross the leg that doesn't have the band over top of the thigh. There we go. And dorsiflex the feet. And now you can take your wrist through it and create a fist to hold it. And the other hand you can use as leverage to open the lifted leg's thigh, getting deeper into that hip. Make sure both feet are flexed. Watch out for the rounding in the low back. Keep tipping the tailbone towards the bottom of the mat. This is super hard to do correctly. Really dorsiflex the foot, especially with your posture, but fight for it. Fight for that pelvic extension. Inhale, prepare. Exhale, arch that back, bracing the low abs. Inhale, use the arm as leverage to open the lifted leg's thigh out and away from you. Push out and away from you. Breathing here. Try to not hold the breath because that's not going to increase the flexibility. Couple more breaths. Using those breaths. After 2 more inhales and exhales, I'd like you to slowly make your way to the second side, setting up, taking that band. So this band assists. If you are able to reach your hamstring and pull it with your hands, then you don't need this band. However, most of the time I see when people do that, they're rounding their low back, and we don't want to reinforce that poor posture. Tip your tailbone back. That's what's causing that low back pain. So if you pull yourself into a stretch that you're not ready for, you can exacerbate pain. Tip the tailbone towards the bottom of the mat. Check out your pelvic position with one hand. Slide it under, create that space, lower the position if there's no space. Pull the abs in. Ujjayi breath. Keep going. Inhale. Exhale. And one more breath here. Inhale. And exhale. From here, we're going to roll off to one side, taking that band off, bringing that band around those upper arms again, making our way into downward facing dog. So what you're going to notice is once that band goes above the elbows and you send your hips back into down dog, your forehead is going to hit the band. I want you to push your forehead into the band to engage your neck flexors. Soft bend in the elbows, tuck the toes under, make sure the knees stay bent. Fight for some extension, that cow pose, arching your low back as you send your pelvis up. Push your head into the band, engaging your neck flexors. Walk your feet in a little bit. Looks like, tip the tailbone up, pull the low abs in, bend the knees. Inhale, head pushes into the band. Exhale, pedal the heels, bending one knee and then the other. Try to brace your abs as you do this. Inhale, exhale, and pedal. 2, 3, 4. Good. Inhale. Exhale and pedal. 2, 3. Tip that tailbone up one more. Inhale. Exhale and pedal. 2, 3, 4. Gently lower the knees to the floor, taking off that second to heaviest loop band. Grab your second to lightest band. This is our green band in our set with the YouniquelyFit. And then you're going to grab your second to lightest Theraband. That's our red band. So we've got the green loop band and the red Theraband. You're going to take the red Theraband through the green loop band. And then you're going to lie on your stomach. So we're going to capture the same foot as our non-dominant hand with that loop band. So it's going to go around the ankle. And sometimes it's easier to get into from a seated position. Goes around the foot. And then from here, the same arm as the foot that you have the band is going to press forward in front of you, overhead press. So you want to wrap it around your hand so that you can give it a nice overhead press with that hand. There we go. Make sure it's around the foot and the foot's flexed. Otherwise, you're going to lose it. Dorsiflex the foot. There we go. Bend the other knee so it's in the same position. And from here, we're going to lift our upper body up, stretching our arms out in front of us. Inhale, lift up. Both arms hover in the air like Superman. And bend at the elbows. Give me 2 presses of the arms up here. 2 presses. 1 and 2. And lower yourself down. Exhale. Inhale, pressing up. Give me 2 presses. Brace the abs. 1 and 2, and lower down. Inhale, pelvis reaches to the bottom of the mat, pelvic floor pulls in and up, press, and 2, and lower yourself down. Switch sides, taking that band to the other side. So we're getting an active stretch for our quadriceps. We're working our low back in extension to combat that pelvic flexion. Make sure when you're in this prone position that your abs are in. You should not feel them pushing into the floor. They're always pulling in and up. Use your breath. Inhale to lengthen and push overhead. Legs are together or hip distance apart if you have back or knee issues. Give me that overhead press. Both arms up. Press for 2, 1. Lower yourself down. Inhale, pull the pelvis towards the bottom of the mat. Lift up, arms reach overhead. Brace the abs. Exhale, press. 2, and lower down. And one more time, lifting up. We press. 2, and lower down. Stretch your legs out. You can release the band. Take your hands to your forehead. Wag your hips side to side, bracing your abs. Hips side to side, legs straight. And wag side to side. Great job.